Hey Alpha Nurses, I'm Nurse Sandra from alphanursguide.com. This is NCLEX PN Review Lesson 43, Maternity Nursing Questions. You can get my notes on Etsy. Be sure to follow my store to get any updates of new notes. You can follow me on Facebook, Instagram, and TikTok for more content. All links are in the description. Without the way, let's get started.
Question 1. The nurse is collecting data from a client who is pregnant with triplets. The client also has a 3-year-old child who was born at 39 weeks gestation. The nurse should document which gravida and para status on this client. A. Gravida 1, para 1. B. Gravida 2, para 1. C. Gravida 2, para 2. D. Gravida 3, para 2. The correct answer is B. Gravida 2, para 1. Rationale: gravida is a term that refers to a woman who is or who has been pregnant, regardless of the duration of the pregnancy. Parity is a term that means the number of births after 20 weeks gestation. It does not reflect the number of fetuses or infants. Question 2. The nurse is reviewing the record of a client who has just been told that her pregnancy test is positive. The nurse notes that the healthcare provider has documented the presence of Goodell's sign. The nurse determines that this sign is indicative of which? A softening of the cervix. B. The presence of fetal movement. C. The presence of human chorionic gonadotropin in the urine. D. A soft blowing sound that corresponds with the maternal pulse that is heard while auscultating the uterus. The correct answer is A. A softening of the cervix. Rationale: during the early weeks of pregnancy, the cervix becomes softer as a result of pelvic vasoconstriction, which causes Goodell's sign. Cervical softening is noted by the examiner during a pelvic examination. Goodell's sign does not indicate the presence of fetal movement. Human chorionic gonadotropin is noted in maternal urine with a positive urine pregnancy test. A soft blowing sound that corresponds with the maternal pulse may be auscultated over the uterus. It is the result of blood circulating through the placenta. Question 3. A premipara is being evaluated in the clinic during her second trimester of pregnancy, which indicates an abnormal physical finding that necessitates further testing. A. Quickening. B. Braxton Hicks contractions. C. Consistent increase in fundal height. D. Fetal heart rate of 180 beats per minute. The correct answer is D. Fetal heart rate of 180 beats per minute. Rationale: the fetal heart rate depends on the gestational age. It is 160 to 170 beats per minute during the first trimester, and it slows with fetal growth to approximately 120 to 160 beats per minute. Options A, B, and C are normal expected findings. Question 4. The nurse is collecting data from a pregnant client who is at 28 weeks gestation. The nurse measures the fundal height in centimeters and should expect which finding? A. 22 centimeters. B. 28 centimeters. C. 36 centimeters. D. 40 centimeters. The correct answer is B. 28 centimeters. Rationale: during the second and third trimesters, the fundal height in centimeters approximately equals the fetus's age in weeks plus or minus 2 centimeters. At 14 to 16 weeks gestation, the fundus can be located halfway between the symphysis pubis and the umbilicus. At 20 to 22 weeks gestation, the fundus is at the umbilicus, and at term, the fundus is at the xiphoid process. Question 5. A pregnant client is seen in the healthcare clinic for a regular prenatal visit. The client tells the nurse that she is experiencing irregular contractions. The nurse determines that the client is experiencing Braxton Hicks contractions. Based on this finding, which nursing action is appropriate? A. Contact the healthcare provider. B. Instruct the client to maintain bed rest for the remainder of the pregnancy. C. Tell the client that these are common and they may occur throughout the pregnancy. D. Call the maternity unit and inform them that the client will be admitted in a pre-labor condition. The correct answer is C. Tell the client that these are common, and they may occur throughout the pregnancy. Rationale: Braxton Hicks contractions are irregular, painless contractions that may occur intermittently throughout pregnancy. Braxton Hicks contractions are normal in some pregnant women during pregnancy. Question 6. The nurse is collecting data from a client who suspects she is pregnant. The nurse is checking the client for probable signs of pregnancy. Which are the probable signs of pregnancy that the nurse should note? Select all that apply. A. Ballottement. B. Chadwick's sign. C. Uterine enlargement. D. Braxton Hicks contractions. E. Outline of fetus via radiography or ultrasound. F. Fetal heart rate detected by a non-electronic device. The correct answers are A. Ballottement, B. Chadwick's sign, C. Uterine enlargement, and D. Braxton Hicks contractions. Rationale: the probable signs of pregnancy include uterine enlargement. Hagar's sign, which is the compressibility and softening of the lower uterine segment that occurs at about week 6. Goodell's sign, which is the softening of the cervix that occurs at the beginning of the second month of pregnancy. Chadwick's sign, which is the violet coloration of the mucous membranes of the cervix, vagina, and vulva that occurs at about week 4. Ballottement, which is the rebounding of the fetus against the examiner's fingers on palpation. And Braxton Hicks contractions. Question 7. The nursing instructor asks a nursing student to describe the process of quickening. Which statement indicates an understanding of this term? A. It is the fetal movement that is felt by the mother. B. It is the compressibility of the lower uterine segment. C. It is the irregular, painless contractions that occur throughout pregnancy. D. It is the soft blowing sound that can be heard when the uterus is auscultated. The correct answer is A. It is the fetal movement that is felt by the mother. Rationale: quickening is fetal movement that appears, usually at week 16 to 20, when the expectant mother first notices subtle fetal movements that gradually increase in intensity. A compressibility of the lower uterine segment occurs at about 6 weeks gestation and is called Hagar's sign. Braxton Hicks contractions are irregular, painless contractions that may occur throughout pregnancy. A soft blowing sound that corresponds with the maternal pulse may be auscultated over the uterus. This is known as uterine souffle. This sound is the result of blood circulation to the placenta, and it corresponds with the maternal pulse. Question 8. The client is undergoing an amniocentesis at 16 weeks gestation to detect the presence of biochemical or chromosomal abnormalities. Which instructions should the nurse reinforce to the client? A. The bladder must be full during the exam. B. The bladder must be empty during the exam. C. She will be given Rogam because she is Rh positive. D. Do not eat or drink anything 4 to 6 hours before the exam. The correct answer is A. The bladder must be full during the exam. Rationale: before 20 weeks gestation, the bladder must be kept full during amniocentesis to support the weight of the uterus. After 20 weeks gestation, the bladder should be emptied to minimize the chance of puncturing the placenta or fetus. Rho immune globulin is administered to Rh-negative women because of the risk of contact with the fetal blood during the exam. There are no fluid or food restrictions. Monitoring the fetal heart tones and the vital signs throughout and after the exam is an important intervention. Question 9. The client at 28 weeks gestation is Rh negative and Coombs antibody negative. The nurse determines that the client understands what the nurse has taught her about Rh sensitization when the client makes which statement? A. I know I can never have another child. B. I am glad I won't have to have these shots if I have another child. C. I will have to have an injection once a month until the baby is born. D. I will tell the nurse at the hospital that I had ROGAM during pregnancy. The correct answer is D. I will tell the nurse at the hospital that I had ROGAM during pregnancy. Rationale: as described in the question, it is accepted practice to administer Rho immune globulin to an Rh-negative woman at 28 weeks gestation, with a second injection within 72 hours of delivery. This prevents sensitization, which could jeopardize a future pregnancy. For subsequent pregnancies or abortions, the injections must be repeated because the immunity is passive. Question 10. While assisting with the measurement of fundal height, the client at 36 weeks gestation states that she is feeling lightheaded. On the basis of the nurse's knowledge of pregnancy, the nurse determines that this is most likely a result of which? A. A full bladder. B. Emotional instability. C. Insufficient iron intake. D. Compression of the vena cava. The correct answer is D. Compression of the vena cava. Rationale: compression of the inferior vena cava and aorta by the uterus may cause supine hypotension syndrome during pregnancy. Having the woman turn onto her left side, or elevating the right buttock during fundal height measurement will prevent or correct the problem.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.